American Heart Association and American College of Cardiology released the new guidelines for blood pressure management on August 14, 2025, and I am sharing the crux and brief about the guidelines with you. In 2003, JNC7 Joint National Committee, hypertension was defined as blood pressure of equal 140 by 90 or more, and the term prehypertension was introduced for 120 to 139 oblique 80 to 89. In 2014, GNC8, the cutoff remained same, but treatment targets were adjusted. Less than 140 by 90 was the target, and less than 150 by 90 for those aged more than or equal to 60 years without diabetes, or CKD. A major change came in 2017 when the ACC and AHA guidelines lowered the threshold for hypertension to equal or more than 130 by 80 millimeter of mercury, replacing pre-hypertension with elevated 120 to 129 oblique less than 80, and stage 1 hypertension 130 to 139 by 80 to 89. The most recent update in 2025, ACC and AHA kept the definition of hypertension at the same, blood pressure of equal or more than 130 by 80 millimeter of mercury, but added new features like the prevent risk calculator, stronger focus on personalized treatment, pregnancy and brain health consideration, and renal denervation for resistant hypertension. I will share a chart which depicts everything about do's and do nots in hypertension. BP category is normal, less than 120 and less than 80 millimeter of mercury, elevated 120 to 129 and less than 80 millimeter of mercury. Stage 1 blood pressure 130 to 139 or 80 to 89 millimeter of mercury. Stage 2 hypertension equal or more than 140 or more than 90 millimeter of mercury. First line for all: DASH diet, decrease sodium intake, increase potassium, but unless CKD. In CKD, you have to restrict potassium. Weight management, moderate activity, stress control, limit alcohol. If BP equal or more than 130 by 80 millimeter of mercury with CVD, stroke, diabetes mellitus, chronic kidney disease, 10-year CVD risk equal or more than 7.5% by using Prevent calculator. The Prevent risk calculator includes a measurement of metabolic health, hemoglobin A1C, heart failure risk prediction. If risk is less than 7.5%, start medications after 3 to 6 months. Lifestyle trial if BP still equal or more than 130 by 80 millimeter of mercury. Stage 2 hypertension, 2 first line drugs in a single pill combo to improve adherence and speed control. In pregnancy, treat blood pressure of more or equal to 160 by 110 millimeter of mercury urgently. Target should be less than 140 by 90 for chronic hypertension. Avoid certain medications, ACE inhibitors, ARBs. Consider low dose aspirin to decrease preeclampsia risk. Resistant hypertension, screen for secondary cause, primary aldosteronism, multidisciplinary evaluation before considering renal denervation. Severe hypertension, BP more than 180 by 120 millimeter of mercury, without acute organ damage, manage outpatient, no rapid IV for oral BP lowering unless organ injury is present. Primary goal for prevention of CVD, stroke, dementia, CKD, and mortality: BP should be less than 130 by 80 millimeter of mercury for all adults.